The federal government says it will require 1.89 trillion naira to successfully implement the new 5-year strategic plan aimed at eradicating malaria in Nigeria. It says about 352 billion naira out of the amount is required for the year 2021 program implementation. In his address to mark this year's World Malaria Day, Minister of Health, Dr. Osage Hanire, said the target set out for the National Malaria Strategic Plan of 2021 through 2025 is to achieve less than 10% parasite prevalence and reduction in mortality attributable to malaria to less than 50 deaths per 1,000 live births by 2025. Joining us now to assess what has been done with a view to underlining what else needs to be done to sustain the anti-malaria drive is Dr. Alero Roberts, a family health physician and senior lecturer, Department of Community Health and Primary Care, College of Medicine, University of Lagos. Welcome to the program, Doctor. Good morning.
Good morning. Thank you for having me.
Good morning, Dr. Roberts. Thank you for joining us. Well, yesterday was World Malaria Day, and the theme was reaching the zero malaria target. But one major concern in the last 1 year plus in the face of COVID-19 is how health systems have been stretched and how countries have had to lose focus in terms of other major challenges, including malaria, of course. What do you think of this? And do you really agree with the view that particularly in Africa, we drop the ball in terms of other diseases, cancer and whatever, because of the obsession with COVID-19?
Thank you, but I don't think it's quite accurate to say that we dropped the ball per se, but it is accurate to say that when you have only a limited amount of funding, then you need to prioritize even more keenly. Now, we've all heard the vast sum of money that the Honorable Minister put out. And the truth of the matter is that the key drivers to achieving a zero malaria target will depend on consistent, constant, committed funding, a very strong primary healthcare infrastructure, and of course, having the database, which is robust data that is being generated from the front line to track, trace and treat all cases of malaria. All these things depend on having a very robust primary healthcare system. And you've heard me say it over and over again, that we cannot continue to maintain this attitude of keeping the most important level of healthcare at the weakest arm of government. We need to do everything we can to ensure that that arm of government is empowered to be robust to deliver what it needs to deliver. The malaria, you heard me say it over again, the symptoms of malaria are so similar to COVID that we saw a huge mix-up with people thinking that, they're treating malaria, when in fact they were treating COVID. Had we had a robust primary healthcare system, we would have been able to test all these fevers to separate COVID from malaria. So I'm not sure dropping the ball was it, but it certainly hit us at a time when our health system is still seriously weakened.
And, enter the new malaria vaccine that's been touted as being 75% effective. What is your reaction to that? 77%. Thank you for that correction. 77%. Because the last one was just 55%. So this is exciting news, I take it. What's your reaction to that?
I mean, I'm a malariologist. I'm absolutely elated that this has been shown to be true. However, note of caution, this is only a process of time because we are now having to go into the phase 3 trials, which will be trialing the vaccine again in a much wider population, a much larger population, to see what else happens, in short. But 77% effective is absolutely brilliant news.
I mean, but this took really long. I mean, when you look at the time the malaria disease was first isolated, I think by British scientist Ronald Ross, it's taken over 100 years to finally get to this stage. So
absolutely.
It's taken over 100 years. But I want to look at methods that could have been used. I mean, we all remember how the West did use DDT and, to eradicate malaria. Correct me if I'm wrong. I think at LNG, I saw a story the other day that they're trying to use sort of like that method too. Is it, that method of, mass eradication, mass spray to make an area no malaria zone any longer? Will that be a better method? Or, since we know that malaria is caused by female Anopheles mosquito, How can we, isolate those female Anopheles mosquito with other biological means? Will that be the best approach? Because we need to get rid of this. It's ruining everybody now.
Tell me about it. I mean, Malaria Day is particularly poignant to me because that was the day I became a grandmother for the first time 6 years ago. And the fact of the matter is that because my grandson has now hit his 6th birthday, he is a survivor. He's a survivor. Malaria didn't take him out, and in pregnancy didn't take him out, at birth didn't take him out in the first 5 years of his life. I mean, this is something that we need to do. And unfortunately, I don't know how else to say it. This is why public health per se is not a sexy disease. It's not a sexy discipline, in the sense that simple things work. It is clearly obvious that malaria, like tuberculosis, is a disease of poverty. When we're looking at the simple things that work, indoor residual spraying, eliminating environmental areas where the mosquitoes can spread, you don't see the spread of malaria amongst the higher wealth quintiles. And when you look at the countries that are being celebrated by this last World Malaria, yesterday, what the WHO was celebrating 46 countries that have managed to gotten to a point where they can say malaria has been eliminated. You look at what they did. It was the simple things: safe housing, good environmental strategies, indoor residual spraying, making prevention the key, as well as being able to test and treat fevers as they appear in a robust primary healthcare center. When we look at our situation and how COVID disrupted supply chains, needless to say, there was almost no primary healthcare center I went to in my many, many visits that had simple things like rapid diagnostic test for malaria. The rapid diagnostic test for malaria at the time was costing something like 30 naira. In 15 minutes, you knew whether the fever you were presented with was malaria or not malaria, so you knew what to do. It's also very sad that I speak to colleagues who will much sooner treat a fever than test it. But then, can you blame them? With the disrupted supply chains, there's almost nowhere where you can find the rapid diagnostic test, as well, talk less, and it's much easier to get the artemisinin combination therapy in a chemist, buy something, swallow it, and hope for the best. But, these are things that we need to look at. Simple things work. Simple public health interventions work. And if we can commit to them through a robust primary healthcare system, where you have the health educators going out, where you have the health promoters, where you have the environmental health officers all playing their parts, being committed to playing their parts because they're being adequately remunerated. They're not to be working as volunteers. Well, then we can talk about elimination.
Okay, very quickly, Dr. Roberts, 2 issues. One, we talked about the Nigerian government announcing some figures. What's your assessment of Nigeria's commitment to the eradication of malaria, particularly with regard to counterpart funding under the Global Fund for Tuberculosis, HIV, and Malaria? Then you talked about primary health care. Now, when you talk about primary health care, that's an indication, one way or the other, that, healthcare is under the concurrent list. What's your assessment of the commitment of the state governments? Because this is not just about the federal government of Nigeria. Do we have this focus that is necessary on primary health care?
I don't want to be arrested.
No, please. Just be,
the point of the matter is we cannot continue to be waiting for donor funds, counterpart funding, money coming from outside. Your house is dirty. You are waiting for somebody to come from another country to come and clean it for you. Come on. The things that we are asking to do are simple things. These are things that if we embed them into our daily routine, they are things that we will achieve. How can we cannot eliminate malaria, for instance, without a robust water and sanitation hygiene system. This is not something that requires counterpart funding. This is something that we just need to do. We just need to do it. We just need to be able to provide safe water supply. We just need to be able to provide environmental hygiene. We've got everything that it needs to eliminate malaria. We're just not committed to doing it. And I say this with a very heavy heart because, we're going to keep on talking. I don't want to be the person you call 25th April 2022 to be saying the same thing again. We're talking about numbers that are so ridiculous. I mean, we're trying to move from 6% treatment to 11% treatment with ₦1 trillion. This is not rocket science. We just need to commit to doing the simple things that need to be done to make sure that we can rid ourselves of this scourge.
Well, I asked you about primary health care.
That's primary health care. That is primary health care. What do we need at primary health care? This thing has been written since the declaration of Alma Ata. We don't need MRI machines and CAT scan machines to be able to deliver primary health care. We need to have a robust primary health care under one roof that operates 24/7, 365 in all areas of the country, manned and equipped and remunerated and funded, so that the health communicators, the health promoters, the health educators, the environmental health officers, the community health extension workers at all levels, they know the community. They know the resident. There needs to be one place a community resident can go to, and anything he needs regarding a mild headache, a fever, whether in him, his wife, or his child, or his unborn child, can be dealt with, where he can get accurate scientific information delivered in a language he can understand and relate to, or she can understand and relate to, where a woman can go for antenatal care and get intermittent preventive therapy. That doesn't need donor funding. That just needs for the primary health care system to be there, to be robust, to be held accountable by the people. So this is not another word to government. This is a word to the community residents to let us rise up and demand for our rights and ask local government to be accountable to us to produce and provide primary health care. It's not rocket science. It doesn't require donor funding. It just requires for us to want to do it, to want to have it, and to demand it as our rights.
Thank you for that excellent point, Dr. Roberts. The lapses in leadership are obvious, but we don't pay enough to the lapses in us, the followers, and our sort of acquiescence to the decay that we see, because we also participate. But I wanted you to also address, well, continue to address what you've already mentioned, the environmental management and how it contributes to malaria, also zoonotic diseases like Lassa fever, and of course, we're in the grip of a pandemic that, according to Chinese authorities, was caused by zoonotic diseases, not a made-up, not a manufactured virus that escaped from a lab. It's been said already that there will be another pandemic. What do we need to do now to keep us healthy?
I can start with the nice big topical headline, climate change, but let's come down to brass tacks. I mean, it's been raining. And I think over the weekend there was quite a heavy rain, and everywhere I went was flooded. This morning I leave the house, I still see the floods there. Those floods mean that mosquitoes can breed. Whether you're talking about malaria, whether you're talking about Lassa fever, whether you're talking about COVID, we're talking the same thing: water supply and sanitation hygiene, first and foremost, personally and collectively within the community. We need to tackle those things. We need to tackle plastic in our drains that prevent the drains from draining away the water. We need to tackle flooding. We need to tackle poor water supply. We need to tackle broken water pipes. None of this is the doctor's or the nurse's job. There are people who are supposed to be doing it. The Ministry of Labor, the Ministry of Roads, Infrastructure, all those things have to be addressed before we can talk about ridding ourselves of malaria, Lassa fever, COVID. Another pandemic, it will come, because we are definitely contributing to making making it, what's the word I'm looking for? A unique environment for another pandemic to arise. But there are things that we can do, and the most important thing is hygiene, cleanliness, water supply. Doing the simple things to make sure that we keep ourselves safe and healthy. Yeah,
the simple things make the big difference. And I think in the spirit of World Malaria Day, we should all sound the warning again, that the word malaria itself is from an Italian word meaning bad air. So let us clean the bad air around us and we get rid of malaria. I'd like to say a very big thank you to you, Dr. Alero Roberts, for your time. Thank you so much, man.
Thank you very much for having me once again.
So yes, thank you very much, Dr. Alero Roberts, and regards to Dr. Roberts. I haven't seen him for a while. Anyway, thank you.